All right, I'm interviewing Todd Burden. He's a physical therapist at St. Bernard's. Been working here 20 years.
Yeah, 23
20,
years.
23 years? Awesome, awesome. Okay, so the first interview question I have is, why did you choose this profession?
Well, when I was looking at things to do when I was in college, I was looking at several things. I think as most kids your age probably are, and I was geared towards something in the medical field. And I was actually in a pre-med program. I have a bachelor's in zoology from ASU.
Okay.
And actually, I was looking at optometry school, but
Okay.
I never really had a job where I worked with people. And I had the opportunity to have a tech position here in St. Bernard's at this hospital in physical therapy. And as I started doing that work, I really enjoyed
Okay.
physical therapy work. Enjoyed working with those patients, the acute care patients, and just enjoyed physical therapy as a whole. And so I changed my path, actually, and went to PT school
Okay.
as opposed to optometry school.
Did you go to PT school here at Arkansas State?
No,
Or
actually, I was pre at Arkansas State.
Okay.
So I went to the University of Central Arkansas.
Central Arkansas, okay.
Yeah.
Okay, I got you. All right, how long have you been working? Okay, so you've been working in this field 20 years.
Yeah,
Um,
23 years. Actually, when I graduated PT school, I came back to St. Bernard's.
Okay.
And I've been here ever since, and I'm on my 23rd year.
Awesome, awesome. Okay. What advice would you give to someone who is pursuing this profession?
Well, I think the best advice would be get as much experience with it as you can, and then not necessarily even if it's in PT, but in, like I know you're working towards an exercise science degree, but working with people, exercise, fitness, and that sort of thing. But the key to that is any kind of experience that you can get where you're working one-on-one with people. One thing that's very important, I believe, in the profession of PT is you have to be able to work with people. You have
Yeah,
to
absolutely.
be able to form relationships with people. You know, a lot of times we're asking people to do things, although we know we're going to help essentially get them better. It may cause them a little discomfort, or even not a discomfort. It may cause them to do exercises or things that they don't want to do.
Yeah.
So you have to be able to read people and develop relationships with people to get them to accomplish that.
Okay.
So I would just say that anything, like a minute ago when I said when I knew I was going to go into some sort of healthcare profession, but I had never really worked with people one-on-one.
Mhm.
So I sought out opportunities to gain that experience.
Absolutely,
It's
yeah.
very important.
Absolutely. Okay. All right, next interview question I have. All right, describe your daily activities. Just describe like what you do on a daily basis. Just a normal work day, really.
Well, I'm kind of unique now. I was a staff therapist here in the hospital, so as far as patient care, I do acute care patients. Over the years, I have worked up somewhat in the management position, and I am director of rehab. That's PTOT in speech here at St. Bernard's. So a big part of my day is management type
Okay.
issues. I'm somewhat unique as though that I do still maintain a patient care load.
Yeah, that's awesome.
So as far as the patient care side here in the hospital, I work with acute care patients, so I see a variety of things from total joints, strokes, just general debility and weakness. We deal with a lot of people here that have pneumonias and congestive heart failure, exacerbations, people that are in just kind of in a debilitated state. And a lot of time our goal with those patients is to get them to a point that they can be discharged from the hospital to another level of care, whether that might be an inpatient rehab or a SNF or outpatient rehab.
Okay.
We here in the hospital also do quite a bit of work with patients in the intensive care unit.
Okay.
We have a intensive care unit team, and so we see a lot of patients in the intensive care unit.
Yeah.
On the other side, as far as the management, it's just the day-to-day, making sure that everybody's where they need to be, making sure that we have the right staffing and the right coverage to take care of our patients. Also, basically a liaison between our physical therapy and the hospital administration.
Okay.
So, I deal a lot with hospital administration, nursing administration,
I got you.
and all those areas.
All right. Yeah, I know. Whenever I talk to Andrew, he tells me all the time about how he does range of motion, especially on ICU patients. So, which is awesome.
Right. Well, our team leader in the ICU team just recently went to an intensive care unit course.
Okay.
It was a nation. It was I forget where it was. It was out of state. I forget where they went, maybe Texas, but the guy that taught it was from Oregon, I believe. And,
Okay.
Just a guru in intensive care unit physical therapy, and he was quite impressed talking to our therapists about how much we actually do in intensive care.
Yeah, that's
unit.
awesome.
So we start therapy very early here in the hospital.
Yeah, that's really good. All right. Physical therapy is now a doctorate level degree. I know back in the day it was a master's. Tell me if you think that is a good change or not, and how it could affect physical therapy as a whole in the future.
Yeah, I definitely think it's a good change. Even take it a step further than that, it was a bachelor's before it was a master's.
Yeah.
And so 23 years ago, like we talked about when I graduated, I was the first entry-level master's program at UCA. So
Okay.
at that time, we were just transitioning from a bachelor's to a master's, and so I was with the first entry-level graduating master's class from UCA. And now you can see, flash forward 20 years later, and almost every, if not every, program in the state is now doctorate. I think that's a very important thing. It helps elevate our profession because of the research now that goes into the doctorate level, and just the training you'll get as a doctorate level, as far as more of the research that we can continue to make our profession evidence-based is very important.
Okay.
We have direct access in the state of Arkansas, as do a lot of states, and moving to that doctorate level was a big part of that. Direct access means that patients can come see a physical therapist now without a physician referral.
Okay.
Now,
Yeah.
that's legally in the state of Arkansas. Now, what's happened is insurance companies haven't quite followed suit yet, so we can't get reimbursed if you come without a physician's referral. But as we continue to elevate our educational background of the program, those things will fall in place.
Okay.
And it's very important to be a doctorate level for those things.
Yeah. Absolutely. Yeah. Okay. And what type of patients do you see on a normal basis?
Well, like I said, acute care patients, which is just a broad scope of patients. We see neuro, we see ortho. Like we talked about, we see a lot of intensive care unit patients, and we just see a lot of people that are here just because they're sick.
Yeah.
Like we said, pneumonias and congestive heart failures and things like that. We also, here in the hospital, do all the or basically all the inpatient acute cardiac rehab we do here. So we work with all the people that have open heart surgery.
Okay.
And all those. So if you name a diagnosis, we possibly could see it at some point here in the hospital.
Awesome.
But go ahead.
Okay. If you were trying to hire a physical therapist, what attributes, skills, and knowledge do you look for in someone who's interviewing?
Well, that's a good question. I look really for someone that's self-directed. We'll back up first. Somebody that's got the interpersonal relationship skills that we talked about, because I think that's very important. I look for someone that, especially in the acute care setting, that's very self-directed. As a therapist in the acute care, there's a lot of times that you don't have somebody right there with you all the time. So you got to be self-directed and be able to make those right decisions, but at the same time know when you need to back off and seek help.
Yeah.
Or get a question answered. And that might be from another therapist, or that might be from a physician or a nurse or another care provider. And that's one thing, when we talk about interpersonal relationship skills being so important, it's not so much always just with the patient, but you got to be able to communicate effectively with physicians, nurses, family members, and just a whole array of people.
Okay.
And that's really a couple of the main things that we look for.
All right.
Obviously, your skills are important as a therapist. But
absolutely.
most therapists' skills are adequate enough. If they have those attributes, they're going to do fine.
Awesome. All right. And then for my final question, just what are some of the activities that you like to do outside of work? Because I know this can be kind of a stressful job sometimes. Just what are some things you like to do just to get your mind off work?
Yeah, well, that's an easy question for me. If I'm not at work, I'm hunting or fishing.
Hunting or fishing.
Yeah, just
Great.
all the time. So.
Awesome. Awesome.
But that's important. That's a good question. That's important that you have things to do outside, because you're right. In any kind of healthcare field, you're going to have a certain amount of burnout rate. And, you're right, because you deal with sick people, you deal with people that are hurting.
Yeah.
Fortunately for PTs, that's not as bad as some health professions
Yeah.
with us. Our stress level, because the majority of the time, not always, but the majority of the time, we get to see. Another reason why I really like to get into physical therapy is we get to see progression usually.
Yeah.
We get to see someone that's at point A and they can't do what they want to do at point F, but we progress them through that.
Yeah.
Get them to point F where they can do that. And that's the rewarding thing of physical therapy. Now, the frustrating thing that can lead to burnout sometimes is if you can't
get the progression.
But fortunate for us, we typically see progression. The times we don't is kind of not the norm.
Yeah, okay. All right, well, again, this is me interviewing Todd Burton, St. Bernard's Health. I really appreciate it, Todd, and thank you a lot.
You're welcome.